Support for this show, Politics Done Right, comes from politicsdoneright.com, publishers of How to Make America Utopia, Take Away the Economy from Those Who Rigged It, As I See It, Class Warfare, The Only Resort to Right-Wing Doom, It's Worth It, How to Talk to Your Right-Wing Relatives, Friends, and Neighbors, and other books written by Egberto, Willies. Welcome to Politics Done Right. My name is Egberto, Willies, your host. Good morning, Houston. Good morning, Harris County. Good morning to the great state of Texas. And of course, good morning to the entire United States. Good morning to the entire world. We are accessing you, or we're reaching you through the magic of the internet, formerly known as ARPANET, created by whom? Again, created by you, created by we the people. Anyway, folks, this is something that we must recover, now controlled again by the billionaires. But without further ado, let's go to the studio with El Señor Howard Reynolds, Jack Van Bever, and Mayana. Good morning, folks. How you guys doing this morning?
Good morning. We're doing great.
Excelente mundo.
Good morning, Egberto.
Good morning, Jack. Don't tell me Howard is back in that cubby hole doing and making sure. And he's having to hold his hands together to keep all those strings going while you get a chance to talk, right?
Dr. Frank Can and String is here.
Anyway, what's up, my man? Tell me about the wisdom of the day. Give us some wisdom. We need it.
Yes. I'm going to go over the Medicare Advantage scam again. New York court ruling will force retired workers into Medicare Advantage plans, which are a total scam. The old bait and switch con. The bait part of the con is no copay, drug coverage, covered dental and vision plan benefits, and some plans offer no premium to get you in the door. The switch is you have just signed away your control over your care to a private for-profit insurance company to administer your Medicare parts A and B. If your care exceeds their plan, the Medicare Advantage have refused to pay for treatment or delay treatment or denial of prescribed drug regimens, which in some cases have caused the death of the patient. To take advantage of you, insurance company also gets an $8,000 payment from the government for signing you up. Plus your Medicare premium and your Advantage premium means they're picking your pocket.
Yes, they are picking your pocket. El Señor Jack Van Bever is exactly right. And I think that's where we're going to start, Jack. I think we're going to start. We have several topics to go over, so that's where we're going to start. Anything else you want to say, or anything Mayana want to say before we get started with this good old program?
No, that was it. Medicare Advantage is a scam.
All right. Excellent. Let's get busy, folks. Let's get busy. First of all, I want to welcome to the home, Joanna de Los Angeles, California. Joanna, I am touched that you are up at, what time is it now? 6 in Central. That means over there in LA, it is 4 in the morning. You're probably like me, insomniac. You know, things I got to think. And of course, we have Jacqueline Campisi, la profesora, the teacher from Katy, Texas. And I repeat to all my new folks that come in every day, I love me some teachers. Teachers are the ones that move knowledge forward. And it is imperative that we ensure that they that we start or restart giving that profession the respect it duly deserves. Lisa Blair from Atlanta, Georgia is in the house. And of course, we have Joseph Collins, Kat, Suzette Jensen on Substack. We missed the first several dozen on Substack, but I know if you have something to say, you will tell me. Anyhow, folks, the subject today, 3 subjects that I chimed out for today. Netanyahu flattened Gaza, bombed and unlived Iranian scientists. Who are the ARC terrorists? He says that
Iran is the arch terrorist. Let's probably get it. I don't know if we're going to get to the subject, but something we should talk about, something you should read about. Charlie Kirk, that young man who talks about the toxic femininity, and he really he really wants to put women in their place, And that's what MAGA and conservatism stand for with all the policies out there. Maybe we get to that. But we want to start, of course, with the privatization of your retired healthcare. Gayla Kunis says, I'm on Substack, retired teacher and USN vet, U.S. Navy vet. First of all, we have a lot of services to thank you for, both serving our country in the Navy as well as being a teacher. Most important profession, bar none. But before I get started, since Johnny decided to call first thing, Johnny, let's take you, but I really want to get to these subjects too for our audience at large. But Johnny, you have the floor.
I apologize for hijacking your show, but I couldn't help it. Listening to Magic Jack's sharing with us the news of that New York State Supreme Court ruling.
Yes.
Do you guys know what precipitated that ruling? Was it the result of a bunch of private citizens like Magic Jack and me and you complaining and going to a law firm and hiring them to represent us in response to something that we're not getting? Or did something else cause them to make that ruling? Because that tells me a whole lot, knowing why they did that.
Good. I'll tell you what, I'm covering that as soon as we get off the line. So why don't I answer that within the context of me talking about the subject? Because Jack, it was supposed to be my third subject, but Jack, he always changes.
Oh, no.
Yeah.
At least you know that we're listening to you.
Yeah. So Johnny, let me talk about it. And if you want to call back after we talk about it, do so. Okay, brother?
If I call back, it will be about some other item.
No problem.
All right. Thank you, sir.
You have a good one, my brother. All right, folks. Look, the New York court ruling will force retired workers into privatized for-profit Medicare plans. What it is, let me start it this way. New York State's highest court on Wednesday ruled against city retirees who had sought to block an effort by Mayor Eric Adams' administration to move them onto a for-profit privatized Medicare Advantage plan. In a unanimous decision, New York Court of Appeals Judge Shirley Troutman wrote that petitioners in the case are not entitled to promissory estoppel, cause of action, the argument that the retirees throughout their employment with the city were promised traditional Medicare benefits when they retired. According to Gothamist, the court also ruled that retirees did not have a legally binding promise from the city that their coverage would remain unchanged. The Wednesday ruling overruled a state Supreme Court judge's decision that had prevented the Adams administration from making the switch, though the Court of Appeals said there were still issues in the case that should be sent back down to the Supreme Court, a lower court in New York State system. Medicare Advantage plans are run by private health insurance who receive money from the federal government to provide Medicare coverage services. Medicare Advantage enrollment around the country is growing, though the Medicare Advantage system has been accused of offering poor care and boosting corporate profits. A 2022 investigation by the New York Times found that major health insurers have exploited Medicare Advantage let's see. That's agreement. I mix up Medicare Advantage to juice their profits by billions of dollars. Let me repeat that sentence. A 2022 investigation by the New York Times found that major health insurers have exploited Medicare Advantage to juice their profits by billions of dollars. The move to switch the city's 250,000 retirees to Medicare Advantage stems from a 2018, this is the part that Johnny's asking about, The move to switch the city's 250 retirees to Medicare Advantage stems from a 2018 agreement between leaders in city government and major public employee unions to cut $600 million from the city's healthcare spending, according to the outlet The City. While we are disappointed in the ruling by the Court of Appeals, the solution to protecting seniors' health care has always been with City Council and the mayor, said Marianne Fizitola, leader of the Organization of Public Service Retirees, which opposes the switch. The City of New York should never, ever be screwing over retirees, and never should the courts. Nobody will ever want to work for the New York City again. Zero trust. Medicare Advantage is a bait and switch scam and betrayal. Enough. City Hall clearly doesn't care about retirees. Justin Brennan, New York City Council said, and Democratic candidate for city controller. All right. That is from an article on Common Dreams. When I read it last night, I wanted to bring it to everybody for two reasons. One is preemption. In reading the note, I don't think the court made the bad decision. I think that the city council and the unions, first of all, the unions didn't stipulate that retirees must get that the premiums for retirees must be Medicare Advantage. Let's put it this way, because I think it's important, especially for all of you that are controlled by, all of you who are part of a union, where the union promises your health care after retirees, so you don't have to go through the trouble of paying your I think it's Part B that people have to pay, and Part D, drugs and a doctor, etc. It is imperative, I think, with all the unions when they're making their deals for getting Medicare or for getting health care after they retire, after the age of 65, that it is stipulated that it is not private health care you want, it's Medicare. Or it's not private healthcare you want, Medicare Advantage. It is traditional Medicare that you want. What just happened in New York, in effect, is that the private sector just got an influx of 250,000 people whom the government pays over $8,000 per person to the private sector. So I didn't do the math beforehand, but as I speak, I will. $8,000 is on the low side because there's all these markups that they do. But in effect, I want to do the math to show you how the private sector operates, folks. That's $8,000 times 250 retirees every month. Listen to this. This is important. Every month, they're going to get, I think, if my numbers are right, about $1.6 billion. Is that what that is? That's no, 1.6 trillion, 250 times $8,000, whatever that is. I did my math incorrectly, but that's what these private insurance companies will get every month. That is every year. $8,000 time 250 retirees. That's $1.6 trillion. Understand what we're talking about here. That is a transfer. Remember, you paid a tax. Everybody who works pay about a 3-point-something% tax on their wages for their health care. Medicare is not free. Medicare is not free. You paid for it. There is a reason Medicare exists. And I want people to understand this because you have the private companies telling you a whole bunch of crap having you believe in these things. Private sector is more efficient than government, etc. Those statements are all categorically false, and it's provably false. Let me just give you a few numbers here, and I'm just pull this out of my head before I continue with the discussion. Let's say that a private company makes on average a markup of, I don't know, let's say they pay an average of 3% in dividends. And let's say they have extenuating costs of 20%, meaning for their executives, for advertising, for infrastructure, their personal infrastructure, meaning computer programs, all this kind of stuff that each private company has to have, right? So right there, they are telling you that the overhead, meaning all the monies that go into pay a premium, that 3% that you paid all your life of your salary is your Medicare premium for future use. They are telling you that somehow all those expenses that they put onto health, that health insurance, meaning executive pay, dividends, computer programs, database management, all of that is more efficient than a government not having to do anything of any of those things. Here's the deal. Remember this. There is a reason Medicare exists. Medicare exists because private companies couldn't find an efficient way to make money on old people, because old people get more sick than regular younger people. Old people cost more than younger people, which means the actual price of driving, the actual price for Medicare would be a lot, for your health insurance, if you include old people, would be a lot more expensive than it is right now. And right now, as it is, healthcare for the average American citizen is also a ripoff, but that's for another subject, another time. The private sector stayed out of providing healthcare for people over 65 because it was too expensive to insure them. So the government created a plan to do it. And that plan was to create an insurance policy that everybody pays into. Todos nosotros tenemos que pagar para el Medicare. We all have to pay for Medicare when we work, which is 3% of our salaries, is 3% of our capital gains, is 3% of whatever we make. Good thing, good deal. We pay for it. It's not free. Now, after years of the government collecting your 3% and paying the healthcare bill, which means the hospital simply bill Medicare, the doctors simply bill Medicare, the drug companies or whatever, with the Part D bills Medicare. That was cool. The private healthcare says, now that the government collects so much money for old people, let's see if we can pay off some senators and Congress people to get into the game. So they get into the game. And now they tell the government, let's see, how much are they collecting in the aggregate for old people per person if we take a look at everybody paying 3% in insurance? So that is what our bill to the government could be. And we can tell the government it's a fixed cost. And when we tell the government it's a fixed cost, we tell them, hey, additionally, we'll take care of hearing, teeth, and all that good stuff that the traditional Medicare don't take up, and we'll say can the 20%, but to can that 20% that Medicare Advantage, that traditional Medicare don't pay, we'll put a premium on Medicare Advantage and convince the government that it's more efficient. And since the government a lot of politicians are paid off, we get it, and that's what they do. We get it. And that's how Medicare Advantage came to be the biggest ripoff scam there is. It provides no better service. In fact, it limits service. I have callers that call in all the time and say, I love my Medicare Advantage. And I understand why. You love your Medicare Advantage while the particular Medicare Advantage plan that you are on is solvent until it is not. And then they either eliminate it or start to charge you or start to deny the services. There's no winners. The only winner whenever you have private insurance is the private insurance company. It is never you. It is absolutely never you. So for retirees in unions, what you have to do is ensure that your union stipulates, because this is what caught the people here in New York. Your union must stipulate in the contract that the free health care you're getting for being a part of that union is actually going to be traditional Medicare, and not that they will go ahead and shop around and allow a private company to say, we can save your union money by costing less than the 20%, the Medicare, the Medigap program and Medicare. I mean, you have to make sure that you stipulate within your contract that if the union's going to pay for your health care, that the health care you want is traditional Medicare, not privatized Medicare Advantage, which can be proven to be a fraud. A fraud. And I would love somebody who sells Medicare Advantage to give me a call and try to dispute that it isn't a fraud. I know what some will say. Some will say, well, poor people can't afford the Medigap plan, the supplemental. They can't afford it. And Medicare Advantage has plans for those poor people who can't afford the 20% supplemental for traditional Medicare. And to which I'll say, I can understand why, given the corrupt system that we have, some people must, for now, until we change it, take Medicare Advantage. But I'll further say that we as a people have to work to rid ourselves of Medicare Advantage. Because the truth of the matter is, if we got rid of Medicare Advantage, the excess that we pay to Medicare Advantage could be there to eliminate the 20% that the person who is on Medicare is responsible for. And in effect, if you want, even take care of not having to purchase a supplemental for the 20%. We would have an all-encompassing, true Medicare program that covers all elderly Americans, meaning Americans over 65 years old. The truth of the matter is what we want is Medicare for all, which covers not just the elderly, but all Americans. And if we do look, the truth of the matter is the following. I would be willing to say that most Americans would be willing to say our working tax for Medicare, to have health care for all, 5% on everybody's, and also make sure that Social Security, everybody pays full Social Security on all their income. We need a complete revamp of our healthcare system. Susan Jagoda, welcome. You're right. We need national healthcare for all. We need to get insurance company out of healthcare. I agree. Lady Historian says, thank you for addressing the topic. And ARP chose United Healthcare for prescriptions for Medicare patients. Very much more expensive and deny benefits. AARP is no longer the friend of retired people. I can just say that. They are selling, they have sold out many a times to Medicare Advantage. AARP should have nothing to do with Medicare Advantage. They should never sell Medicare Advantage. Ever. So folks, that New York City story is an important story, not just for New York. It is important for us those of you in unions right now to make sure that the charter, that it's changed. The agreements need to be modified. Never, ever go for Medicare Advantage. And anybody selling you Medicare Advantage, you look at them in their eyes and tell them to make, and by the way, those people who sell Medicare Advantage, look, if you see a salesperson in a HEB or wherever, they'll have a table set up to get, to sign you up. And they'll be selling Medicare supplementals. They'll be selling those so that if you know what you're looking for, and you definitely tell them, I want Medicare, traditional Medicare. I don't want Medicare Advantage. They won't let you go. They'll sell you something. They'll sell you the Medigap right there. They'll say, okay. But but Medicare Advantage, you get hearing and all of that, and then they'll say, if you are strong-headed and you say, I want this traditional Medicare, you don't go for the sales crap. They'll have something to sell you for the 20%, the supplemental. They'll sell it to you to pay the part that the traditional Medicare doesn't pay. But they make a bulk of their money selling you Medicare Advantage. I have a friend who used to come into Kingwood, and after he's done selling his product, this insurance product, he'll take me to Luby's for dinner. Because he lives way on the other side of town, and he'll just come, hey, let's go out to dinner. And I would shake my head and I'll be like, look, man, I'm going to tell you straight up. He says, look, he would look at me and say, if I don't sell it to them, somebody else is going to sell it to them. And the program that I sell them is not all that bad. But they would come here and they'll get to all these older folk and they'll sell them a plan. And for every plan that he sold, if he'll take 20 people out for that 20 people that are on traditional Medicare, he'll take them to Luby's and buy them a lunch and buy them dinner or whatever, and then show them that the supplemental that they pay, instead of paying that supplemental, why not just switch to Medicare Advantage that costs you nothing? You don't even, it costs you nothing, or it costs you very little. And guess what? It even allows them to check your ears, check your eyes, and it may give you a little stipend for dental. And for each one of those people he sold, he made over $2,000. Like that. The fraud that is within there. So, I mean, if he set up dinner for 20 people, get 10 people to sign up, he just walked out of Kingwood with $20,000. And the thing about it is that you think about that. That is $20,000 out of health care. That's $20,000 for getting somebody to switch from traditional Medicare to Medicare Advantage so that they will have a lot of their issues denied, and one person make a huge profit, and then the company makes a windfall for you to do something against your own interests. But they have it down very well. The sales pitch is near perfect. It's a sales pitch that a 65-year-old that isn't headstrong. And the truth of the matter is, most of us at 65 or at any age aren't necessarily sufficiently headstrong to get around psychological pulses that these guys have researched. We know if we touch this button, if we touch that button, a certain percentage of Americans will bite. That's why we are here, folks, to try to inoculate you from the psychological embrace that these people have on quite a few people's minds. Anyway, let me go to Patrick. Come on in, Patrick.
Hey, good morning.
Good morning, sir.
Talk. Not why I called. Good talk. It's not why I called in, but I will tell you that while I'm thinking about what you're saying, I've heard it over and over, but it kind of brings me back to the bait and switch scams that had to be outlawed, where they would department stores and things would put up ads and offer just ridiculous sales on items. It would bring people in, and then those items they would say were sold out, and then they would show them something else that wasn't as discounted, trying to get them to buy it. That's a lot like that. That's what it reminds me of, the scam.
That is Medicare Advantage. You're absolutely right. You're absolutely right. That is what Medicare Advantage is, a bait and switch, and it always hurt the person on. And the thing about it, when you don't need health care and you're paying that low price or no price, or you're getting it for free, hey, you're not getting it for free. We're paying for it. But I mean, you're sitting down there and it's like, oh, it's a good deal. But the first time you get some disease that a hospital don't cover, Tom Hartman came onto my program a few months ago. I think it was a few months ago, maybe a year or two. And Tom Hartman had a good friend, and this good friend had a very severe case of cancer. And he went to he checked out everything, and he went to the Mayo Clinic. And when he went to the Mayo Clinic, it turns out that he told the Mayo Clinic he had health care insurance, etc. It turned out that after flying, I think where's the Mayo Clinic in I don't remember where it's at, but he went out there, and after they did a whole lot, they found out, oh my God, sir, you're not covered. We don't take this Medicare Advantage. His friend died.
His friend died and probably left his relatives a lot of debt.
Exactly. But so anyway, tell me what you're calling for, because my phones are filling up.
Okay. I'm going to be a broken record on the Iran deal. But there's absolutely no reason to go to war. If we go to war, that it's going to end us. It absolutely will. Even if this doesn't end in a catastrophe, this will be the last large war we get into, because it will be the last one we can quote unquote borrow for. We can't even afford it.
Colonel, I read. You sent me a lot of material on that. I'm glad you did.
I listened to a very good interview from Colonel Douglas McGregor. He's a retired colonel and a military analyst and advisor. He says what they're doing right now, the battleships and the aircraft carriers. He says he's seen this over and over since the 80s. He said that they're going to bombard Iran, and they're going to spend a whole lot of money doing very, very little. It's just going to upset people in the area. It's going to lead to a long war. He said that this will probably be the end of Israel, because they're in over their head, and eventually we're not going to be able to afford to keep funding them. He said that this is going to be a multi-year, if not multi-generational war. It will not end. Iran is not the type of enemy that is going to back down, negotiate. They were hit for no reason. And I want to point out that Iran started off with their most gentle weapons. We thought that they were running out.
I read that. I read that. But Patrick, I want to talk about Iran after I do Medicare Advantage. So I have that in the subject list for today. So let's go ahead and do that after this. But let me get to Jimmy, because Jimmy is he loves his Medicare Advantage, and I want to talk to him about that. All right.
Absolutely. Everybody go to moveon.org and tell your congressman that you do not want to go to war. We can't afford it. This will be the end of our benefits.
Thank you, my brother. I appreciate you, Patrick. All right. Come on in, Jimmy.
Hi, I'm calling because last night Stephen Colbert had an amazing guest on, a member of Congress named Maxwell Frost, F-R-O-S-T.
Love Maxwell.
He's the youngest member of Congress. He's only 28 years old. But he really talked about how Trump, with ICE, they're picking up Hispanic men and so forth. They wear masks, and they just take these people away. Their families don't know where they are. They're checking with hospitals and morgues and all that. And these men wear masks, so you can't tell who they are, but they take these people away, and you never hear from them again. They just disappear. It just sounds like Nazi Germany. I mean, what they're doing. And I urge you to get Maxwell Frost on your program. Interview him. He's only 28 years old. He's the youngest member of Congress. He's very articulate, and he can tell you all about how the ICE people are operating really with no due process. On those 250 people at $8,000, that's only $2 million. It's not $2 billion. $2 million. And I love my Medicare Advantage. I pay no copay for doctor's visits or hospital visits. So what more can you ask for?
Well, I know you. You're a healthy person. Just don't get sick. That's all I'm going to tell you. Don't get sick, because then you'll find out what the plan is really like. You work out, you eat well, you do all the right things. You know what I tell you all the time. You are the youngest 90-something-year-old I know.
And I'm one. Yeah, I think maybe the government's giving $8,000 per person. Maybe that's too much. Maybe they could cut that down to $4,000. I don't know.
Oh, no. Actually, let me tell you, Jimmy, and you and I, to go over this back and forth, the program needs to go, because while you do well, while Jimmy does well, Jimmy doing well, but most people not so, is not a viable solution. And again, we can have a Medicare system that is just like the Medicare Advantage that you think you like, that costs just as much as you are paying, which is zero. Because for you to pay zero, Medicare Advantage receives the same amount of money, if not more, than a supplemental would have cost you. So therefore, we can eliminate Medicare Advantage, have traditional Medicare pay the supplemental, and guess what? It's again Medicare that after 65 you pay nothing. What we are doing is donating. We are donating billions of dollars. I repeat, we are donating billions of dollars to private insurance companies, shareholders, and private executives. I know that's not what you want. I know you want that money going for healthcare, don't you, my brother?
Yes, but I'm thinking maybe they could just pay less instead of $8,000, pay $4,000.
But still,
Maybe
why should shareholders make money on healthcare that you paid over decades, 3% out of your salary every year? They come in and they say, I will manage your healthcare. Remember, insurance companies don't do anything. They just pay a bill. Can't we get the government as a nonprofit to pay a bill, sir?
That's right. They just pay the bills, but maybe they're efficient. Maybe they have good computers and good employees and so forth.
Oh, wait a minute. Let me ask. Actually, I want to stay with you on this. Actually, because I want to convince you right here. Ask you something here. You said maybe they have better computers. If they have better computers, couldn't the government hire the same people that gave them better computers so that we don't have to repeat that for however many insurance companies we have? That's my point.
Yeah, the government can be just as efficient. Of course, they were all off on holiday yesterday, so.
Yeah. And by the way,
yesterday you did not give Emancipation Day enough anything from your mouth. That was a big national holiday, very important holiday.
I was told that. That's my screw up. I should have spent more time on that. And by the way, it is the 8. I don't know what I did with my math. That is $2 billion. The 8,000 times 250,000 is $2 billion. My math just went haywire. Sorry about that.
I didn't hear 250,000. I just heard 250.
No, it's 250,000 retirees at 8,000, at more than 8,000. So it's at least $2 billion that New York pays into the insurance companies. $2 billion.
Yes, that would be $2 billion. You're right about that. $2 billion.
Yeah. So thank you very much. Talk to you later, Jimmy. Appreciate you.
One more thing.
Yes, go ahead.
Kudos to President Biden, who came to Galveston yesterday to help celebrate Emancipation Day.
I heard that.
A lot of people don't know what the hell Emancipation Day is. You need to tell them all about it.
Thank you, my brother.
Okay, thank you, Egberto. Bye-bye.
Take care. All right, let's go to Johnny. Come on in, Johnny. I
can attest firsthand to what you're talking about with regards regards to suggestibility in senior citizens. I am witnessing right now an older relative who, because I go with him to his doctor appointments, I'm able to witness correct information that he gives that's not always accurate. So I would suggest to our fellow time travelers in the audience who have relatives who are requiring medical care on a regular basis, the seniors in their family, if they can, either them or someone else in the family, go with your loved one to the hospital or to doctor appointments, because there's a good chance that they will misrepresent unintentionally the chronology of events, let's say, and what they felt, how they feel, and that will affect the rendering of a diagnosis by the doctors. The doctors aren't sages. They have to ferret out all this stuff and be medical detectives. Why make their job any harder than it has to be? So please, if you have someone in your family who requires care and they're a senior, go with them. So you are spot on about that, Egberto. Now, that $2 million gift, that's what my calculators showed, $2 million based on the numbers you gave. That
No, $2 billion. $2 billion. It's 250,000 times 8,000 per year that New York gives for them. $2 billion.
Okay, I thought I multiplied 250,000 by 250,000 by 8,000. Anyway, it doesn't matter whether it's $2 million, or
it's $2 billion.
2,000. Okay, $2 million dollar gift. Yeah, $2 million. That's what my calculator showed. $2 million. M, not B as in boy. But anyway,
no, brother. No, wait. I want to get that number right for our audience, because I got it wrong in at first when I said 2 trillion or whatever. It is $2 billion that New York has to pay for health insurance. It's 250, not 250, but 250,000 retirees times $8,000 per retiree.
Oh.
It's a lot of money. So mucho dinero. There you go.
Yeah. Whether it's 2 million or 2 billion, that's a gift from the New York State courts, along with, I would assert, the complicity or the purposeful incompetence of union leaders and city politicians. So what's the lesson here? The lesson is, just because you work in an industry that can be unionized and you are a member of a union, or that you help create a union for yourself with your friends, that doesn't end with voting. You just don't go to the voting booth and vote, and then you think your job's done. You've got to be actively involved. That's the only check we have. So, and there's one last thing. I heard something very disturbing on Arnie Arnson this morning that occurred to me. You and I talk about this all the time, but it occurred to me that in the national media, we hear all the time this assertion that the American people are against both the Republicans and the Democrats. And they say, and they don't like this, and they don't like that. But these folks, they never point out, and I have to sadly say, Arnie Arnson has never said, but people also want the Democratic Party to cleanse themselves of their centrist leaders. They never say that. You and I say it.
Yeah.
But I don't hear it on the national level, and that kind of disturbs me.
Well, let me tell you. Let me tell the audience this in general. What happens is everybody's talking about the Democratic Party is in the dumpers, and they're correct. And they're in the dumpers because Democrats are, when the pollster asks Democrats, they give a negative statement about Democrats themselves. It's not the same that applies to Republicans. Are very tribal. In other words, they can hate the Republican Party, they can hate their reps, but they're Republicans, and so when they are asked about it, they support the Republican Party. That's not how Democrats behave. If Democrats don't get what they want, they hate the party. That's why you see 29%. And by the way, look at Wisconsin. For people who are concerned about the 26th election, Wisconsin is a good example. If you look at the polls for Democrats in Wisconsin, it's way down. But if you look at the results, and it's not only in Wisconsin, all over the country, Democrats are overperforming, not because they're Democrats, but because of the policies that folks think Democrats represent. They don't like the party of weenies that you're talking about, Johnny. And in fact, I wanted to play a piece by a professor of from USC, where he taught, and I'm trying to get an interview with him right now, where he talks about the best thing that really just happened to us is when we saw the No Kings protest. And the reason that was so important, it says that people are not doing what many other people in other fascist countries do. And that is just sit back and accept. Americans are still willing to come out in the streets. And what he says is, you cannot, I hear on MSNBC all the time, the institutions are holding. Well, they didn't hold, the Supreme Court didn't hold last night when it told Gavin Newsom that Donald Trump has the right to take his troops, his National Guards. They ruled last night that he could. The Ninth Circuit Court, I believe it was. All right. So institutions at the lower levels are holding. I don't expect the Supreme Court to hold, which means the people have got to hold. And what No Kings pointed out is that the people are likely not going to tolerate this attempt to change us into a fascist state. And for me, guys, I live in Kingwood. I live in a very, 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 very conservative part of this metropolitan area. And when in Kingwood, Texas, the reddest part of Texas. Okay. Now,
you live in Pineville, Texas.
Listen to me, Brian. I mean, not Brian. Brian comes next. Listen to me, Johnny. Johnny, listen to me. Okay. It turns out that when we overperform by 1,000% in the people we got out there, I mean, it means that people are at arms right now. We had more people than any protest that was ever held in this area by a factor of 10, 1,000%. Anyway, gotta go, Johnny. You had 2 bites of the apple today. You overeater.
Really quick, Marco Rubio, what he did to the postal employees.
Yeah, we'll talk. Hey, not a new subject. We'll talk tomorrow. Come on in, Brian.
Yes, good morning. I hope everyone has a good weekend.
Good morning, sir. Talk to me.
So, has anybody been to the Veterans Administration lately to actually go in and see the patients and go to the front counter and ask for directions, or see the photograph of the President of the United States? It's his mugshot when he was arrested. Did anybody know that?
Okay, what's your point?
I mean, that takes some guts, doesn't it? You get arrested, you get a mugshot, and now you're supporting the Veterans Administration. That takes some guts, man. I like that.
Okay.
That proves the identity of the president.
Okay. I like the way that you stick up for felons. Anything else, sir?
Felons, huh? Yeah, you never saw the movie on YouTube, have you? You won't look at it, you won't watch it, but you will watch MSNBC. It seems like you give opposition no treatment like you do to someone that agrees with you.
No, it's not about it's not about agreement. It's simply this, sir. I don't allow lies. There are certain things that are absolute lies, and it won't be allowed. That's it. Continue, my brother.
She told you she read 300 pages of medical transcripts, and she disagreed with the COVID shot, and you tried to change her mind, and it didn't work.
No, it's not, brother. It's not about changing minds, sir. It's about, look, these are health issues, and I'm not going to use my program to get people killed. That's what your president did. Your president got a lot of people killed because he used the platform that he has to do wrong. But anyway, I got to go to Bobby. Thank you very much, Brian. Bobby, come on in.
Hi, Bobby.
Hey, good morning,
okay. Hold on a second, Bobby, because before we cut Brian, he was saying, my body, my choice. Your body, your choice but the air belongs to all of us. So if you want to put your body in an infective state, that is okay. We'll just lock you away from everybody else so that your body don't infect us. Thank you. Come on in, Bobby.
I'm not really sure who, pushed for the vaccines, but I will say I watched an article the other day. This is from 2023. It's actually a little video. This guy, and I researched it after I saw it because I really had a hard time believing it. But they were saying that the morticians, the people who do like, them bombing stuff, that they're used to 4.5, they could use one injection site. Now they're saying it takes about 2.5 hours. They're finding for people these rubbery clots. They're like white clots that they've never seen before until the vaccine rollout. And I mean, it's not like a little bit; it's a lot. They're saying that, so basically, you can research this. 30 to 50% of the people now, since the COVID vaccine, are walking around with these white, fibrous, spongy clots that are all like riddled through their system. And also, there's an increase in the purple chili clots. And also, they said that these corpses are having like what they call coffee grounds, dirty blood of these little coagulated pieces in their bloodstream. I'm not trying to lay blame on Democrats or Republicans, but I had no idea that people were walking around with all this inside their body until just the other day, and it's not on the news or anything. I was just really shocked because let me just tell you that really bad, Flo, as an engineer, we handle what's called flow, and when my daughter got her AVM that caused her stroke, etc. I also did a whole lot of research on vein flow and the different flow pressures that connect stuff. Okay, let me just tell you from an engineering and a scientific point of view. I don't know where you read that, but based on the pasty. No, but what I'm saying, sir, look. Let me just say one thing, right? I can create a body of research that seems voluminous easily on the internet. But I can tell you one thing. If there were people walking around, as you say, we would know it by now and people would be collapsing based on the way blood flows. So, I mean, let me just tell you. I challenge you to research it. Just go to your AI and ask, are morticians complaining? And you'll see that it's a fact. I didn't believe it either.
Look, let me just tell you. What you're saying, and please, I want you to think about this. Is there any reason for me, if you come out with something that says XYZ, to just call it wrong or call it out? There's no reason. What my program is supposed to do is make sure that people are informed and what's best and what's best for them. And not only that, if I'm proven wrong on something, I will come on air and tell you that I'm wrong. But what I won't do is I won't just go ahead and look up different kind of research, etc., and give people angst for things that just aren't there. I can't do it. And there's no reason for. What I'm saying, sir,
if
is
you were to go to your AI right now and any platform you want and search it, it'll tell you that what I just told you is true.
Well, sir,
I
again,
challenge you to do that, Egberto, because I didn't believe it either, and then I started researching on different AI models. And they can't explain it.
I research everything, people. When you tell me things, I'm going to go on my own and look it up to see what's out there. Okay, well, dude, please. Actually, that's a good thing. Send me the link. And then, send me the link at kpft@politicsandright.com.
I'm telling the truth.
All right. Send it to me, okay? All right, we'll talk later. Let's go to Clarence. Clarence, you're on.
Clarence, I'm on?
Yes, you're on.
Yes, what I'd like to talk about is the war with Iran.
Yes, go ahead, sir.
Don't realize that the United States of America has been in a state of war with Iran since 1979. We are at war with Iran. A state of war exists and has existed. What bothers me about the American people is no one seems to understand that. that a state of war exists and has existed, and nobody seems to be aware of it. The United States of America routinely commits acts of war in foreign countries, and the American people somehow are unaware of it. They just don't, I guess they can't handle the truth. And as an example, when we went and killed Osama bin Laden, and I'm for that, I think we did the right thing in Pakistan. But in doing so, we committed acts of war against Pakistan by going into that country and killing that gentleman. And I've got other examples. But again, it bothers me that no one understands that the international relationships.
Let me just say that, first of all, Clarence, you're right, and I've spoken about that all of the time. You hear me talk about the invasion of Panama. You hear me talk about, and even Israel is a proxy for the United States as they bombed Iran at this last time. So, what saves us from any major war is because of how powerful we are. But the blowback that comes back never comes back in the form of war, but it comes back in the form of what we call terrorism. I think what you said, if most Americans understood, and that is what we try to preach all together, is that, it is something to watch. Let me tell you that Patrick pointed out something important when he called in earlier and brought up Iran before we wanted to discuss Iran. And now we're not going to have the time to discuss Iran. But in that we are near the limit as far as what we can afford to do these things. So let me just say that I got to let you go now to jump to the studio. But thank you for pointing that out. Okay. Thank you, sir.
God bless America.
God bless America. Studio.
Yes.
You're on. We're at the end of the show. Want you to give your final word or Jack's final word?
Yeah, no, I got nothing here. I was kind of busy training and doing stuff, so I wasn't concentrating.
Okay, so I kind of caught you off guard. Anyway, no problem, my brothers. Look, all the listeners, let me tell you something. Let me real quick. Oh, I don't have much time, but let me tell you real quick. I listen to everything. I research. When I hear something, even sometimes it's crazy, I'll do a quick research and say, that is makes sense or not. But you're not going to get conspiracy theories from me. You're not going to get fallacies from me. And when I do make mistakes, I promise you, I will come out here and correct my mistakes. Just to err is human. Anyway, love you all. politicsandright.com/newsletter, the rest of the program, politicsandright.com/newsletter. You can also email me directly at kpft@politicsandright.com, kpft@politicsandright.com. My name is Egberto Willies. This is Politics and Right, and you guys know how I end this baby. I am what? Out!
Support for this show, Politics and Right, comes from politicsandright.com, publishers of How to Make America Utopia, Take Away the Economy from Those Who Rigged It. As I See It, Class Warfare, The Only Resort to Right-Wing Doom.